ABG TIC TAC TOE. ABG stands for arterial blood gas and is a blood test that measures the acidity, which is the pH, and the levels of oxygen and carbon dioxide in the blood. Blood for an ABG is taken from artery, whereas most other samples of blood is taken from the vein, and thus the name arterial blood gas. The purpose of this video is a guide for you to interpret the arterial blood gas results in a simple version. So for this, we need to know what is the regular and normal values for pH, HCO3 and PaCO2. For pH, the normal range is 7.35 to 7.45. HCO3 is 22 to 26. And PaCO2 is 35 to 45. So any value that is more than 7.45 for pH or 26 for HCO3 is considered alkaline, and anything that is lower than 7.35 for pH and lower than 22 for HCO3 is considered acidic. Whereas the case is reversed in the case of PaCO2. Here, it is the exact opposite of pH and HCO3. Anything that is below 35 is considered alkaline, and anything that is above 45 is considered acidic. This might be a little confusing, so let's recap on that. The pH range is 7.35 to 7.45. HCO2 is 22 to 26, and PaCO2 is 35 to 45. It is important that we memorize these ranges in order to be able to interpret the results accurately. So anything that is above 7.45 for pH and 26 for HCO3 is alkaline. Anything that is lower than 7.35 or 22 for HCO3 is acidic, whereas for PaCO2, anything that is more than 45 is acidic, and anything that is less than 35 is alkaline. So pH is used to determine if the blood is acidic or basic. So if it's experiencing acidosis or alkalosis, which is basic. HCO3 represents the metabolic aspect of the acid base, and PaCO2 represents the respiratory aspect of the acid base. When we're trying to interpret the results for arterial blood gas, there are three questions that we have to ask ourselves. Number one, is the blood acidic or alkaline? Basically, is it exhibiting acidosis or alkalosis? Number two, is this a metabolic or is it a respiratory aspect? Metabolic meaning HCO3, respiratory meaning PaCO2. Number three, which we will discuss soon, is if there is any partial compensation, P for partial compensation, or is it uncompensated? Firstly, we will try to solve it as doing the usual tic-tac-toe. So let's say we are given three values, one for pH, HCO3 and PaCO2. Let's say for pH we have a value of 7.25, HCO3 we have a value of 21, and PaCO3 we have a value of 32. So in this grid that we have over here, we have to label it. Labeling it as acid, normal, and basic. The pH value of 7.25, if we look at this range here, 7.25 is considered acidic. So I will put pH under the acid column. If we look at HCO3, it's 21. So HCO3 over here, 21 is considered acidic. So I will put the HCO3 under the acid column. If we look at PaCO2, the result is 32. So for PaCO2, 32 is in this region here. So which would mean that it is alkaline. Since PaCO2 result is interpreted in the opposite way of pH and HCO3. When we look at the results here, you can draw a straight line down this way. As such. And the interpretation, pH is under the acid column, so it's acidosis. HCO3, which is metabolic, is also under the acid column, so it is metabolic acidosis. The PaCO2 is under the base column, which is the opposing end of acid. So if it's in the opposing end of the acid, it is trying to maintain its homeostasis. It is trying to increase the base level so as to compensate for the acid level. So what is happening here is a compensated metabolic acidosis. However, we can't compensate it fully, so this is considered a partially compensated metabolic acidosis. Okay, let's look at another case. Drawing back our tic tac toe, acidic, normal, and basic. So let's say we have three results. One is 7.46, 27, and 46. So these three results here. pH is 7.46, so 7.46 is considered to be under the basic. So we put a pH under the basic. HCO3 is 27, which means that 27 over here it is also basic. So we put the HCO3 under the basic. Lastly, under PaCO2, result is 46. 46 is in this region, which means it is the opposite of pH and HCO3. In terms of interpretation, it is thus acidic. And we place it under the acid column, PaCO2. You can draw your tic tac toe line over here. Interpretation, pH is under the base, so it's alkalosis. HCO3, which is metabolic, is also under the base. As such, it is metabolic alkalosis. PaCO2, on the other hand, is on the acid column and is thus trying to compensate for the basic nature. This would help us to make the interpretation as partially compensated metabolic alkalosis. Here we have another example where pH is 7.32. 7.32 would mean that it is acidic, so we put the pH under the acidic region. We have HCO3, which is 24. 24 is neutral, so it's the normal region. We put the HCO3 in the normal region. Okay. PaCO2 is 49. 49 is in this side of it, which means it is acidic. PaCO3. Acidic. Here, the tic tac toe would go this way, which means pH is acidic. Acidosis, PaCO3, which represents respiratory. So here you have respiratory acidosis, and HCO3 is in the normal region, meaning the body is not trying to compensate the acidosis as such. This is a non-compensated respiratory acidosis. I hope this video has helped you to have a better understanding in interpreting the arterial blood gas results. Always do remember to keep in mind the 3 questions. Is it acidic or alkaline, which is based on pH? Is it metabolic, based on HCO3? Is it respiratory, based on PaCO2? And is it compensated, partially compensated, or is it uncompensated? Do check out the next video for more worked examples. Please like and subscribe.